All right, so let's go through some of the different revenue models that we typically see in social entrepreneurship. And I'll give you examples of companies or nonprofits that they may have been used in. And we're going to go through a spectrum from who the customer is. Is it a low-income customer or a high-income customer? And who's paying? And what are the different ways that they're paying? So the first one we're going to talk about is the high-volume, low-cost model. You may have heard people refer to this as the bottom-of-the-pyramid business model. And that's because it's serving a large volume of people who have low income. I try to avoid using bottom-of-the-pyramid terminology, but that's how people have used to refer to this model. So an example of this, Hippocampus, which we talked about a few modules ago, they're trying to kind of be like this, where they want to serve thousands, if not potentially millions of people, and they want each person to pay a very low cost. So each child's family is paying less than $5 a month for their early learning centers. And the idea is that each early learning center will have a very small margin of surplus revenue that can make this venture financially viable. So the idea is that the more people you reach, you can operate at a small volume, at a small cost. So that's the first model, is high volume, low cost. So everyone's paying the same, they're paying a small amount, and then it generates a small surplus revenue. If you have enough people, then you have enough financial viability. Now, moving on along the spectrum is differential pricing. This means that you're serving some low-income people and some middle or higher income people, and you're charging it, and they're paying for your services, but they're paying different prices. One example is the case study we're going to see at the end of this module, which is Aravind Eye Care Systems, also in India. So it's the same service for everyone, but low-income people can have this service, which is the eye cataract surgery, at little or no cost, and then middle or high-income people can pay a higher price. And this cross-subsidizes people who are paying little or no price. Another really important point, if you're going to do differential pricing, is that you're advertising to people on the quality, not on the differential pricing. So no one's going to choose an eye surgery center because they want to help someone else. They're going to choose it because it's the highest quality eye surgery. So that's differential pricing. I also want to mention that you can have differential pricing across location. So another example in Egypt where I worked is Educate Me, which provides Montessori-style education centers, where you have the same curriculum and the same high-quality education in different neighborhoods. And all the children in the low-income neighborhoods pay the same. All the children in the high-income neighborhoods pay a little bit more and cross-subsidize the low-income neighborhoods. But it's that same high-quality education. So you can have customers of different income cross-subsidizing each other at the same location, like with Aravind Eye Care Systems, or you can have customers at different locations cross-subsidizing by location, like in Educate Me. So that's the differential pricing model. Third, there are other cross-subsidization models other than differential pricing, and I've seen some of these in primary health care in low and middle income countries. When people come in for a consultation with a healthcare provider, that's not, if they're willing to pay a small fee, that's not going to really cover all the costs. But some services can cover the costs of the consultation. For example, these social entrepreneurs found that eyeglasses and blood tests, diagnostics, and also birthing services may be services that have higher margins and generate more surplus revenue, and that these can help cross-subsidize other services which are more time-intensive and costly, like the consultations with the healthcare providers. So in this case, we're cross-subsidizing across services rather than customers or locations. So an extreme form of cross-subsidization is the buy one, give one model. You may be familiar with Tom's Shoes, for example, which was one of the most well-known social enterprises for a while. And this Tom's Shoes was basically where they designed a certain shoe that was sold to high-income customers in high-income countries, and then all the profits from those shoe sales went to distribute shoes for free in low-income settings. So that's what we refer to as buy one, give one. There are many doubts and controversies about this model because the product is designed around the high-income customer, not the low-income customer. And also because at the end of the day, what you're doing is actually charity. You're just giving away shoes in this low-income setting. Additionally, there may be some unintended consequences, like putting local shoemakers and shoe sellers out of business. So even Tom's, which was the most famous example of buy one, give one, has evolved to another model where rather than giving away free shoes, they are now redirecting 1/3 of their profits to supporting grassroots organizations in those low-income countries who are working on more systemic change. And so buy one, give one as a concept has evolved. Warby Parker is an example of, they started out that way with eyeglasses and sunglasses, and they also are now redirecting that profit rather than giving away things to supporting grassroots organizations working on systems change. But I wanted to mention this model in case you hear about it, so that you know that it's an extreme form of cross-subsidization and that there may be other ways to create more systemic change rather than buy one, give one. And this evolution of the business model of Tom's is quite common. Business models, you might start out with something and then evolve into something else. And that's okay. That's a totally normal part of the process. I also want to say that a lot of social entrepreneurs rely on a hybrid or mixed model where they have many different sources of revenue that add up to cover their costs. So an example of this is Vision Spring. Vision Spring is a social enterprise that aims to support vision around the world through low-cost, high-quality eyeglasses. And they cover about 20% of their costs through direct sale to low-income customers, which is that first high-volume, low-cost revenue model. It doesn't cover all their costs. It covers only a fraction of it. So then they rely on other sources, such as grants and fundraising, to cover all of their costs. So that's what we call a hybrid or mixed model. And sometimes a social entrepreneur or group of social entrepreneurs might create multiple organizations to achieve their goals using a hybrid mixed model. So they might have a for-profit company and a nonprofit company operating as sister companies. An example of this is the Women's Program Association that we talked about in the last module, that was working in the refugee camps in Lebanon, where the Women's Program Association had charitable activities, and they started a new company for Sufra, the catering company and food truck, to generate revenue to help fuel these activities. So moving on, the next revenue model I want to talk about is grant-based or charity-based. An example is Rebecca Hope, my former student who founded Y Labs, an organization that offers design thinking services with youth around the world. Her customer is the nonprofit organizations, foundations, and aid agencies and governments that serve youth. And so they provide Y Labs with grants in order to deliver their services. The key thing here is that Y Labs views these grant-making organizations as a customer. So it really is a sustainable revenue model because they have a value proposition not only to the youth, but to the payer, the nonprofit organization or grant-making organization. So it's not really a charity. It's that the grant-making organization is a customer. And charity and donations might end up factoring in a small part in your revenue model if you have a hybrid or mixed model, but I hope you'll find a paying customer, whether it's the end user or an intermediate organization like Y Labs did. And then at the end of the spectrum is responsible business, which I wanted to include in the social entrepreneurship spectrum because here we're talking about more traditional commercial businesses that are not necessarily serving marginalized populations. They're just participating in the market, but they're trying to do things differently, and they're finding a place along their supply chain to create social and environmental outcomes. Examples of these are Patagonia and Seventh Generation, which are global for-profit organizations based in the US that provide consumer goods like clothing, sporting goods, household detergents, etc., household items. But they try to do so in a sustainable way, and it's really ingrained in their mission and their values and their team and their training and their business model and everything to find ways to reduce their carbon footprint, to think about how they're going to create culture and community that's socially responsible among their teams and among the communities they serve. And then lastly, I want to mention the importance of cost reduction models. So it's not just figuring out where you're going to get revenue from and who's going to pay for your offering, but also how can you lower costs to create financial viability. Cost reduction models may be the primary business model for entrepreneurs that are operating in existing organizations. So for example, if you're innovating within a public health agency or other public agency, your customers aren't going to pay for your offerings. They're already expecting it from you. But you may be operating within an existing budget of that agency, and your innovation might find ways to create better outcomes with that for the same costs. So through that cost reduction, you're able to fuel and fund your innovation and roll it out and achieve financial viability because you're saving money for the organization that you already work at. So these are the different forms of revenue models and cost reduction that helps achieve financial viability that are commonly observed in social entrepreneurship. So take a moment to think about them, look up the different organizations that I've shared as examples for these revenue models, and then in the next video, we're going to talk about payment, which means like, how is this revenue coming to you? And that can vary across revenue models.